We're also reporting an additional 11 deaths, bringing the total now to 1,571, and that includes one denotification since yesterday. Of the 1,571 deaths to date, 651 have been hospitalised, that's 41%. 76 have been admitted to ICU, which is 4.8%. 785 were male, 786 females, 50-50, with a median age of 84 and a mean age of 82. There have been 393 admissions to intensive care to date. Currently, there are 53 people in intensive care, and there was one new admission to intensive care in the last 24 hours. There are currently 321 confirmed cases of COVID in our hospitals, with 16 admitted over the past 24 hours. As of midnight Monday, the 18th of May, there had been 24,204 cases notified. Of those, 3,164 had been hospitalised, that's 13.1%. 393 had been admitted to ICU, which is 1.6%. The ratio of males to females is 43 to 57. 31.9% were healthcare workers. The median age of all cases to Monday night was 48 and the mean age was 51. Looking then at clusters in our residential care facilities and our nursing homes. To date there have been 463 clusters in our residential care facilities, which is an increase of 5 since yesterday. And in nursing homes the figure is 258, which is no change from yesterday. Laboratory confirmed cases to date in residential care facilities, there's been 6,276, which is an increase of 28 on yesterday, and in nursing homes there's been 4,872, an increase of 13 on yesterday evening. To date there's been a total of 978 deaths in our residential care facilities, of which 851 have been in nursing homes, and they represent 62.3% and 54% of all deaths to date, respectively. I have a small bit of additional information this evening on recovery. So of the 24,176 laboratory confirmed cases reported to Sunday at midnight, 19,224 can now be regarded as having recovered in the community. That's 79.5%. And a further 1,836 have been discharged from hospital, that's 7.6%. So that total of 21,060 represents 87.1% of all laboratory confirmed cases diagnosed to date. So that's 87.1% of cases can be regarded as having recovered. And that, of course, is not to say that some people within those figures will not still be living with the sequelae of Covid-19. It merely suggests that they've recovered from the initial episode. Thank you. So we can take questions now.
Dr. Glynn, can I ask you about the ongoing confusion around the 2 hours that any two people should be in the same room, the 24-hour period? We saw the court service today take the action that no courts would sit longer for 2 hours. It looks like this has been just new advice that was given to the Oireachtas yesterday. Can you maybe clarify exactly what the rules or the guidance are?
Okay, so I think it's not surprising that there's confusion because it's a little bit technical, but I think the first thing to say is that I wasn't privy to the specific guidance that was given to the Oireachtas, but I believe it was guidance given by the Health Protection Surveillance Centre. And the guidance that the Health Protection Surveillance Centre uses in general, and which it has used throughout this process. So there hasn't been a change in this component of the guidance. But what that guidance says is that for contacts who've shared a closed space with a confirmed case for longer than 2 hours, a risk assessment will be undertaken, and that will take into consideration the size of the room, the ventilation in the room, and the distance that the person was sitting from the confirmed case. So the 2 hour guidance is something that public health doctors use after someone has been confirmed as a case. And they use that to decide who else can be categorised as a close contact and therefore needs to stay at home. So in the event that there's a confirmed case in a workplace and someone has been in the room with that confirmed case for more than 2 hours, public health doctors will do a risk assessment, and they may well deem that the person is a close contact and therefore needs to stay at home for the 2 weeks after that. So I am assuming that the guidance that was provided to the Oireachtas said that if you hold a meeting for more than 2 hours, have all of these people in that meeting room for more than 2 hours, and one of those people is subsequently confirmed to be a case of COVID, then that may have implications for everyone who was in that room at the time, and everyone who was in that room at the time would therefore have to stay at home for the next 2 weeks. And that's not to say, it's not the same as saying that every business and every organisation in the country can't have people in the same room for more than 2 hours. But what it does say is that if there's a confirmed case and people have been in the same room for more than 2 hours, it's likely that at least some of those people will be categorised as close contacts. So the message to employers and to workplaces generally is, in the first instance, as much as possible, limit employees coming to work during this phase. If people can work from home, they should work from home. Limit in as much as possible meetings of any size. If meetings do have to take place, if at all possible, keep them less than 2 hours, so that you're minimising the risk in the event that someone in that room becomes symptomatic subsequently and is confirmed as a case of COVID.
So essentially is the advice that employers, perhaps the court service, they need to balance up the work that they're doing with the fact that somebody could become a close contact, and that they need to bear that in mind?
Precisely. I mean, everything that we're doing as part of the response to COVID is a balance of risk and benefit. There's nothing that we do that doesn't have risk and benefits. And it's the same for all sectors of society and the measures they're taking or not taking at the moment. And employers this guidance would have been in place going back even before the measures went into place. The restrictions were put in place. This guidance would have been there. So risk assessments like this have been ongoing since the start. But as we begin to open up, yes, employers do have to accept that there is some level of risk with opening up, and we can't get away from that. There's no, as I said, there's no relaxation of measures that doesn't result in at least some level of increased risk.
Can I ask you today, 4 in 10 pubs in Dublin say that they're going to reopen their doors as restaurants because they also hold restaurant licences. They're going to reopen on the 29th of June, which is, I think, 6 weeks before pubs are due to open in Phase 5. What do you make of that?
So I haven't seen that. So I have to respond based on our engagements with the trade and the sector to date. And certainly, you'll remember back in March that the vintners associations came forward and said that in their opinion they couldn't comply with the public health guidance that we had issued out there, and they voluntarily chose to close on that basis. Clearly now, as we move back out of this phase, we want all sectors to be able to move up, to open up as quickly as possible, but that has to be done in a phased manner. It has to be done in a safe manner, and clearly we'll continue to work across government with all sectors to ensure that where possible we can open up. But as things stand, pubs, there was not an intention that pubs, at least in the traditional sense that we understand pubs, would open back up at that date.
Well, I spoke to a publican today. 60% of his business is actually food, and it's the restaurant side of the business. So it isn't that they're reopening the pub, but that they want to reopen the restaurant. So do you think in cases like that, where they can do it safely, where they can maintain social or physical distancing, where they can have perspex in place or whatever other measures that they have, that they should be able to do that then?
So again, we've been very clear from the outset of this that we're not experts in the precise details of each sector, whether it's education, whether it's restaurants or hotels or whatever setting. We have given broad guidance. We hope that sectors will adhere to that guidance. The HSA has given guidance as well in relation to workplaces. So regardless of which sector we're talking about, the priority has to be the safety of employees and obviously customers and clients using those services.
Can I finally just ask you then, Gardaí were called to the 40-foot today, a number of swimmers who'd gathered. Are you worried or concerned about scenes like that? I know obviously we've had McDonalds opening today. There was a long queues, albeit people were in their cars. But what's your thoughts on that? We're only a couple of days into Phase 1.
We are only a couple of days into Phase 1, and I think, but we're a good number of weeks into this response as a whole, and I can only comment on what the majority of people have done. And clearly the majority of people across the entirety of society have stuck with us on this. They have followed the guidelines, and it's thanks to those efforts that the numbers have come down, that we're going in the right direction. And if people stick with that, hopefully in another 2 weeks, we'll be able to relax or recommend the relaxation of further measures so that we can all move forward in a positive way.
Rob O'Hanrahan, Joe.ie. Can I just come back to the 2-hour limit that's been spoken about quite a lot this week? Can I ask, is there a time limit on that 2-hour limit, if that makes sense? Is that going to go away at any stage, for example, when we hopefully open again fully on August 10th? Or is that going to be something that sticks with us now for the foreseeable future?
I wouldn't envisage a situation where that 2-hour limit would change in the context of a risk assessment that's done by a public health doctor following the confirmation of a positive case.
So that advice is likely to be with us beyond the reopening of the country. I'm just thinking in terms of ramifications for airline flights, for schools, for example, that will have to be considered as part of this new normal from even into the autumn and beyond.
So I think very importantly, again, I wasn't privy to specific advice that was given to a specific sector. So I can only comment on the guidance that public health doctors use when they risk assess following confirmation of a case. That would have been there from the start of this process and will remain there for the foreseeable.
Sorry, just on the foreseeable, it's beyond phase 5. It's into phase 5 and beyond that. Just to be.
Yes. So if let's say we move forward to September, and we have 1 confirmed case on a given day in a workplace somewhere in Ireland, or 2 confirmed cases. At that point, the public health doctors will have to go in and assess that workplace against these criteria to deem who else in that workplace might be a close contact. And in that case, those close contacts will be asked to stay at home for up to 2 weeks. And the reason for that is to prevent spread to other employees and to prevent other cases.
When you say they'll be asked to stay at home for 2 weeks and self-isolate for 2 weeks, will they not be tested as close contacts of a confirmed case of Covid-19 as per the change this week?
They will, yeah. So they will. They'll be tested on day. So they'll be tested the day they're identified, and then they'll be tested again. But again, so that's new guidance that's come out over the past week. Elements of the guidance as a whole, of course, change all the time. That's the purpose of the NEFIT meetings every week. And it's likely that the guidance around testing and contact tracing will evolve as we learn more and more about this disease.
Can I ask about the at-risk numbers that were given yesterday? Is it possible to get a further breakdown in terms of hospitalizations and any deaths, if any have occurred?
Which group, sorry?
So the at-risk groups that were given yesterday, so for example, homeless shelters.
Sure.
Yeah.
So the additional information I have is just the numbers that were hospitalised. So within the 19 cases in prisons, 2 have been hospitalised. Across the 22 cases in the Roma community, 7 have been hospitalised. Across the 46 cases in the travelling community, 2 have been hospitalised. Of the 171 cases in direct provision, 14 had been hospitalised. And then of the 20 cases amongst those who are homeless, 5 have been hospitalised. And then of the 828 cases in the meat processing facilities, 16 had been hospitalised as of last Saturday night.
Can I ask, have any deaths occurred in any of those at-risk groups?
There have been 4 deaths within the Roma community. And I'm not aware of any deaths in any of the other groups.
Okay. Finally, from myself, can I just ask, Dr. Tony Holohan isn't here this evening, and we were informed earlier that he would be. Can I ask, is the plan for him to return later this week? And if he doesn't, will NEFIT go ahead? Because, say, for example, it didn't go ahead yesterday when Dr. Holohan was in front of the Oireachtas Committee.
Sure, it's planned that Dr. Holohan will be back at work tomorrow.
That's great. Thank you.
Hi, Rory Walsh from News Talk, a very late substitute for Shane Beattie, so go easy on me, please. Just in regards to the schools, News Talk Breakfast had Professor David Nabarro, a special envoy from the WHO, on this morning, and he stated that now is the time for Ireland to look into reopening its schools. From NEFIT's perspective, what are the main stumbling blocks to even having a phased reopening at the moment?
So it's not that there's only one particular stumbling block. Our peak in cases occurred quite a bit later than many other countries across Europe. And so that allowed us, on the one hand, on the way up, it gave us time to get ready. It allowed us to build capacity in terms of PPE, in terms of our testing capacity, in terms of ventilators, in terms of our ICU capacity. But what it's also done is that on the way back down on the other side of this curve, it's allowing us, because we're coming down that curve at a later stage than other countries, it's giving us an opportunity here in Ireland to learn from what other countries are doing. We're aware that many countries across Europe have opened up some segment or sectors within the whether it's creches or primary education or secondary education. So we have an opportunity to look at what's happening there, to learn from what's happening there, to ensure that when we do reopen components of that we can learn from best practice and avoid an increase in cases. Professor Nabarro said we should think about it. We of course we're thinking about it. We're continuously thinking about it. But in particular, we're thinking about how it can be done in the best manner possible. And again, on NEFIT, we're not experts when it comes to school environments. So we will be guided by colleagues across government in relation to that. But our job is to look at the evidence that's emerging internationally. And we would be delighted if that evidence suggests that there isn't a risk or that the risk is low and we can move forward with that. But again, it would be remiss of us, given the opportunity that we have relative to other countries, not to take the opportunity to learn from their experiences over what is a relatively short time frame of a couple of weeks. And that's not to say, of course, like we're very aware that the effects that this is having on children and parents in terms of not being able to go to school. So of course we're looking at it all the time and trying to learn from what those other countries are doing.
Okay, and just on the schools as well, if we take it that they're not going to open until September, are there certain recommendations and structures that can start that you can start putting in place now? Or are they going to have to wait till closer to September to see where we stand in regards to the virus?
So I know that colleagues in the Department of Children and Youth Affairs, for example, are already looking at the issue of creches and how best to reopen creches, what measures might need to be in place for the protection of the children, for the protection of the staff, for the protection of the families of the children. And of course, a similar approach will need to be taken. But again, that's not for the details of how to do something safely in any one sector is not a matter for those of us who sit at NEFIT. We give guidance in general terms, and we look at the experience internationally. We of course look at the disease in terms of where it's at here in Ireland. And we will work with colleagues across all sectors to ensure that what's planned is based on best available evidence. But ultimately, colleagues across government are planning and ensuring that they too are working to ensure that when kids go back, for example, that they do so in the safest way.
Okay. And just finally, with some fast food chains opening up the drive-thrus today, is there any specific area during that transaction that you would advise people to stay vigilant during? Is there any part of that transaction that maybe mightn't be the safest? So I guess in general terms it comes back to the basic measures, which is that if you're going out of your house, wash your hands before you leave the house, wash your hands when you go back in. While you're out, practice physical distancing, and practice respiratory etiquette. If you're in a crowded place, wear a mask or wear a face covering. And regardless of the sector, whether it's a fast food outlet or another outlet, all of those measures should continue to apply and unfortunately will need to continue to apply over the coming weeks and months. Thank you.
Dominic McGrath, the Journal.ie. Just a question on the HSE temporary accommodation scheme for healthcare workers. I'm just wondering, as hospitalization rates drop, as the number of cases decline, will that scheme be extended, or could it become, I guess, a semi-permanent scheme as long as COVID-19 is in our community?
Well, that's something we introduced for healthcare workers who are either were acquiring the virus or who were in danger of acquiring the virus in congregated settings where they were living. So one of the more positive aspects, as you've heard, there were no new outbreaks in nursing homes, a small number of new cases. So one of the sequelae of that is that the number of people applying for accommodation in order to avoid living in a congregated setting has fallen off quite dramatically now. That isn't to say we won't need that in the future. So just like the isolation facility we're retaining in City West for patients who are unable to isolate. Similarly, we are helping not just our own healthcare workers, but we've also helped the Department of Justice in some direct provision citizens in making sure they have access to self-isolation, where the Department of Justice were asked for our help. So we will retain the capacity, but the demand has dropped off quite considerably.
And could you give an indication of that kind of demand? Like, what are the current kind of figures for people who apply?
I haven't got the exact figures, but I know from earlier last week it had dropped off quite. It was 3 or 4 weeks ago. There was quite significant demand, and now it's dropped off quite considerably. But I'll get you exact figures.
Great, thanks. Kind of related to that, obviously meat processing plants have been significant clusters, and there's different speculation over why that is, whether that's procedures in plants or whether that's workers, many of whom are on low wages, going home to quite cramped accommodation. Is it being considered to introduce any kind of temporary accommodation scheme for workers in risky industries like meat processing plants?
Just on that issue, the issue of outbreaks in meat processing plants is a huge concern to us at the moment, given that we're seeing patterns in residential care settings finally settle. But in meat, we're now facing 15 outbreaks with, I think, 860 cases in meat processing plants. So this has been managed nationally by a national outbreak management team and by local public health departments. And the scope of their work on each site involves inspection of each site, looking at the workplace settings, also inspection of where people live, because it's as likely, if not more likely, that some of the workers may have acquired the virus or may have transmitted the virus where they live rather than the workplace. And part of the whole menu of public health actions which follow, including identifying, isolating, contact tracing and so on, will be offering alternative accommodation to people who they believe may be at risk of either contracting the virus or passing it on. And clearly that advice, that's part of their engagement with each of those 15 outbreak sites. Beyond, I haven't got figures exactly on how many people have taken off offers of alternative accommodation, but it is some part of the menu of actions that our public health department will offer in each individual site.
So the HSE is offering alternative accommodation for workers?
We're helping support them, yes. This is a multi-agency because it involves the Department of Agriculture, it involves the employers, so clearly it's not just up to ourselves to provide alternative accommodation. Our primary responsibility through our public health departments are to issue advice, and clearly that advice in the case of meat plants is conveyed to the staff and the people affected, and to the management of meat plants, and to the Department of Agriculture, who have an interest too. But clearly it's in a wider public health interest that we're able to support any of the actions followed, which may include offering alternative accommodation.
Okay, and then finally, I don't know if you saw the comments today from the director of the ECDC that a second wave of the virus across Europe is highly likely or highly certain. I'm just wondering if those temporary accommodation schemes will continue, or they've been, I guess, it might be an option if we do face a second wave and spread them, I guess, across maybe more frontline sectors and extend them a longer length of time. Is that something that might be useful?
Well, it's been a key. It's been a key action that we've had to take to limit to break the chain of transmission of the virus in long-term residential care settings, and indeed outbreaks in hospital settings, because we know from the figures now that a significant proportion of outbreaks or of cases among healthcare workers are community transmission, and not just nosocomial or healthcare acquired. So those we will have to remain as vigilant in the future and for the foreseeable future in terms of minimising the likelihood of community-based transmission among healthcare workers, as we do in minimising the likelihood that they will acquire it in a healthcare setting.
And would you just finally, sorry, would you agree that a second wave across Europe or across Ireland is highly likely?
So, I mean, I think inevitable is a very strong word. We've shown here in Ireland through the actions of the population, and numerous countries have shown across Europe that this can be controlled, it can be brought under control. There's no doubt that we have to live with this virus for the foreseeable future. We don't have a vaccine, we don't have a treatment, and we've only one type of test as things currently stand. It is a challenge, but we have seen that with the measures we've taken that we can control it. So I would not like a message to go out that there's nothing we can do as a population to control this. There are measures that we've taken, and again, we've seen people's compliance, we've seen their willingness to engage with this, and hopefully if we do face a challenge down the line, a further challenge down the line, we're not over this challenge. I think it's very important to state that. I think I said that in the last 24 hours there was 16 people admitted to hospital with Covid-19, so we shouldn't become complacent too quickly in relation to this. But I would be hopeful, given our experience to date, that if things do go in the wrong direction, that we know what measures to take.
Great, thanks.
Hi. Good evening. I just wanted to touch back again on the schools situation. I think it was the National Parents Council also were speaking about it today, and the possibility of having a return to primary school before the summer break, maybe for 6th class kind of cohort before they move on. I mean, is NEFIT's public health advice on that still under review? Is it still open for, a change before the summer, or in your mind is it set that schools won't be back till September?
So as things currently stand, we don't envisage primary and secondary schools being back before September.
So that's not under consideration, or it couldn't change depending on the course of the disease or what you may learn from other countries? Or, are we willing to learn from other countries in a sense that we move stuff forward, or, because they're ahead of us in the curve? Is that not an opportunity to say, well, we might be able to do things faster rather than learn and still do things at the pace that we've set out?
So there's an opportunity to learn, and that's what we're doing. Whether or not there's an opportunity to do things faster or in different sequence, I'd be very hesitant to commit to anything like that at this point. In terms of the phasing, we've taken a middle road between the ECDC and WHO, who recommend 2 and 4 weeks in terms of the timing between moving from one phase of relaxation to the next phase. So I certainly don't see any speeding up in terms of the phases. And in broad terms, I don't see any change to the measures that we've set out across those phases and the timing of those measures within the phases. But we have been clear that we continue in particular to look at the issues that have arisen for children and parents in relation to the measures that have to be taken to date. And we'll be giving further consideration to that at NEFIT this Friday and again next week, with a view to seeing if there are measures that can be taken within the context of the public health guidance that can make things easier for those children and their families in particular.
So I was going to ask, was there any update on that kind of discussion, but there won't be till Friday then?
No, the next NEFIT meeting's Friday morning. Yeah.
Okay. And sorry, just to go back to the pubs again as well, I know you acknowledge that NEFIT or yourselves are not experts in this field. I know the vintners have been seeking meetings with NEFIT and government. Do you think it would be a good idea to meet them then, given you're not experts in the field, to discuss the plans? They are saying, a number of them, that they will open on June 29th, and there are, I think, 50,000 people's livelihoods in that sector. Do you think it would be a good idea to meet them?
So I think across government there's an openness and a willingness to engage with all sectors in relation to reopening, the timing of reopening, and I know the colleagues across government are more than happy to do that. Obviously, as part of that, we're very willing to feed in from a public health perspective and give public health advice and guidance. But that is our role. Our role is to give the public health advice and guidance. And obviously there's considerations much broader than that, depending on the sector, that we're not experts on and that we don't profess to be experts on.
Okay, thanks.
Mark Coughlin from Primetime.
Mark.
In about an hour and a half ago, a press release was put out with Dr. Holan's name to be at this press conference. Obviously, he's not here. Is there anything you can tell us about his absence, given he's a major public figure, without going into any? I don't want to pry, obviously, but if there isn't anything, that's fine.
No, as things stand, Dr. Holan will be back tomorrow evening, or back at work tomorrow morning. Yeah.
Okay, perfect. About two weeks ago, Dr. Holan mentioned a metric, a number for the period of time between when people become first symptomatic and the period of time that they're being swabbed. which is obviously an important number because it's the period in which they contact their GP, and the urgency of that is, you know, important for breaking the chains of transmission. Is there an update on that number that you might have?
I certainly don't have that this evening, no.
Yeah, I do recall, I think the discussion came up when we were talking about the period of transmission, which is we know now, this is the first reported case through the ECDC was March the 12th. When they reported a case, we know now that people can be transmit pre-symptomatically for 48 hours before the onset of symptoms. I think, if I'm right, what happened at that particular press conference, we were encouraging people, in view of the fact that there's pre-symptomatic transmission of 48 hours, and in view of the fact that we were working away at trying to get that turnaround time for positive tests from ordering right through the completion of contact tracing down to now 90% within 3 days. We were encouraging people to present as early as possible before then, so that there would be no every day or half day earlier they present and get tested. That's less time they could be transmitting the virus. I think that might be what you were referring to. I'm not sure.
Yeah, I'm just wondering, is it a number that you're tracking, and has it improved, or is there any? He said it was 4 days at that point, which was about 2.5 weeks.
Well, you see, we don't know until somebody presents. We don't know, but we know that once they present, 85% will have been swabbed either that day or by the following half day.
No, and I understand that. I'm not questioning whether your time frame should be sped up or anything. I'm questioning, is it a metric that you're tracking, and is there an update you can give me on the number? Because obviously you don't have control of.
No. Well, unless we asked everybody who presented when they first developed symptoms, and then tracked it against when they presented to a GP, which we don't, as to my knowledge, ask everybody. It would be a considerable exercise to ask everybody who presents, considering that there's a 3% positivity rate when they first develop symptoms, and then the lag time between then and but to reassure people, what happens is once people are positive, we track back in terms of contact tracing to 48 hours before, to allow before they first develop symptoms, to allow for contact tracing to take place, not just from the time they develop symptoms, but from 48 hours before.
And Mark, I think a key component at the moment that lessens the importance of the question that you're asking about in terms of that as a metric is the fact that we've started testing contacts. So we're not waiting for people to become symptomatic anymore. Thanks to the capacity that we have and the excess capacity we have at the moment, we can now immediately test people once they're identified, which will hopefully in turn lead to less symptomatic cases presenting.
Indeed. A question on the other numbers that are in the press release. 87% of people are recovered. Doing some quick maths, I worked out that's about 3,000 active cases. Would that be correct to say, or would that be a number you would? I mean, if you just take 87, if you take the number of total cases, reduce the number of deaths.
It would be the total cases minus those who've recovered, and you have to take into account the number of died.
It's the total number of cases minus those still in treatment in hospital, minus those who've been diagnosed but are still in the community within the last 14 days, and minus those who've passed away. So if you've been diagnosed within the past 14 days and you're still in the community, you're not classified as recovered.
Can you explain that? Sorry, I didn't quite keep up there.
So if you're diagnosed today with COVID-19, you won't be and you're well enough to stay at home, unless you become admitted to hospital in 14 days' time, you'll be classified as having recovered in the community.
So they would be in the.
So the vast majority.
In the 13%, not the 87%. Yeah.
The people who've been diagnosed in the last 13 days or 14 days, who've been well enough to stay at home, would not be classified yet as having recovered.
So that would be an active case.
That would be an active case.
Do you have a breakdown of the active cases that of essentially that 13%, I suppose, as in community?
I can get that for you. Yeah. I don't have it here tonight, but I can get that for you. Yeah.
Okay. One other question about. There was a lot of discussion at yesterday's press conference about nursing homes and visiting restrictions and stuff like that. Going back to that time period, there was advice given to healthcare settings, or hospitals, I think, about a protocol for transferring people back into long-term residential facilities. The earliest I could find was March 19th for that advice. Would that be the earliest advice, or was there prior advice to that?
we can double check for you, but I think actually the earliest guidance around that was around the 10th of March. So that was, gave protocols then around managing the safe transfer of people at the time. You have to remember we had actually very little COVID actually in either acute hospitals or residential care facilities at that time. The protocols were based on that. But those transfer protocols are being reviewed again. They're being reviewed on a constant basis. And they're particularly being reviewed in the light of the, I suppose, significant outbreaks that we've had in many residential care facilities, and making sure that we can ensure that as some of those facilities start to open up again, that we try and, manage the safe admission and discharge of people between those facilities as we go through.
I think the most up-to-date advice is available on the website now, but if I could get a copy of the original
I'll have a
advice,
look. I'll talk to colleagues in the HPSC about it.
Thank you. Cheers.
Well, Colin from the Irish Times. Dr. Glynn, just back to this 2-hour issue. Can you just state as clearly as possible for businesses and sectors of society like the judiciary, there is no bar, or is there any bar on any business or any sector holding a meeting that lasts longer than 2 hours?
No, so to be absolutely categorical, there is no bar to any meeting lasting greater than 2 hours. But if a meeting does last greater than 2 hours and someone at that meeting...
There's ramifications from that.
Yeah.
And we know that we've gone through them,
Yeah. So to avoid those ramifications, some workplaces, some settings may decide to limit a given meeting to 2 hours or less.
And would you be concerned about the interpretation that's been put on the advice to which you're not privy, I know, by, for example, the judiciary and possibly other sectors? No.
So again, I'm not aware of the specific advice that's issued from the judiciary. I'm not even privy to the advice that issued to the Oireachtas. All I can speak about is my knowledge of the risk assessment that's undertaken by the public health doctors in the aftermath of a case.
Yeah, and in relation to schools, is there not a case for, I'll make two suggestions. One is an experimental return to school, because I would predict that a large number of parents wouldn't want to send their kids back to school. So you would be able to do an experimental return to school involving a low number of children, and I think that's happened in places like Australia, for example. And the second thing is, given the concern which is out there about a possible second wave coinciding with flu, and given the fact that children have missed so much of their education, is there not a case for revisiting your plans in August and say that schools start back early, they catch up on some of the work they missed, and they get more of that in before a potential rise in the autumn or in the winter from flu and COVID?
So, two parts to the answer. I think it would be difficult to identify where you would start with an experiment if it was to be...
What about Waterford, the county with the lowest number of cases?
So again, things can change very quickly with this disease. What I would say in relation to there are reasons why we haven't opened schools to date. So there's a small amount of evidence which suggests that transmission, that children, we know that children in general who do get this disease are not affected severely. That's positive. It appears that children do not transmit to other children or to adults. But we don't have definitive evidence on that. We don't even have strong evidence on that. And we don't know for sure how many children or what proportion of children get this disease, carry it asymptomatically, and transmit it to other members of the community, whether that's parents or vulnerable members of the community. So we need to be careful in what we do. In relation to August, as I've said, this is constantly under review. We know so much more now than we did 4 weeks ago, 6 weeks ago, in relation to this virus. And we'll know an awful lot more in 2 weeks' time and 4 weeks' time. So we do keep it under review. But as we sit here at a given point in time, we have to say what we believe to be the case at a given point in time. And as we sit here now, with the evidence that we have in front of us today, we don't envisage schools reopening before September. But of course, we continue to review the evidence as it comes through, including from all of the countries across Europe that have moved forward.
You mentioned us being behind the curve of other countries by a week or two, I would say that is, and yet I could name 5 or 6 countries in across Europe who are either opening their schools now or are going to do it on the 1st of June, and yet we're going to be months behind those. So where's the match up on the curve there? Well,
I think the first point is that many countries peaked at the end of March. if you remove the German, the tests that went to Germany and that were backdated, our peak number of reported cases wasn't until the 23rd or 24th of April. So that's significantly later than many countries. Many of the countries that did peak at the end of March, in fact, have only reopened their schools within the last week to 10 days. Now, I know Denmark opened obviously before that, and that's the one in particular that people keep pointing to, and thankfully there doesn't seem to have been any negative consequences of that. But equally, we've seen the experience that's been reported in the media with France and a number of schools having to close there over the past number of days. So I mean, it is obviously also related to the time of year that we're in. But as I said, we will continue to review the situation as evidence becomes available.
Okay, thanks.
Thanks.
Oh, sorry, just one question. No, sorry, it was being asked already about the Chief Medical Officer.